All right, good afternoon, Lagos. Yeah, and good evening to everyone all across the world. If you're listening to me now, you're welcome to our broadcast today again. Of course, like we do every Monday to Saturday, 30-minute broadcast. So, welcome and thank you very much for joining us again today. If you're listening live on YouTube, Facebook, and Twitter, and of course on the CIN radio, that is www.cinnigeria.com/radio. I want to say thank you very much for your time and thank you very much for joining us today. Today, we'll be talking about something very important. And as you can see already, one of the key questions we have there is think that well, it's not really important because you think you don't really have to donate blood. Well, we're going to learn more about blood and blood donation and even transfusion. Yes, my guest is she's a doctor. She's a hematologist. And of course, in case you don't know, yesterday was the World Blood Donor Day. Yes, World Blood Donor Day. And of course, today's discussion is in celebration of that and in observation of the World Blood Donor Day. So it is something that we all need at one point in our life. If you look all around your family, you probably will know someone who had, at some point had needed blood, in need of blood. Yeah, the blood, they're not a manufacturer, a human being body from the cup. So I have Dr. Uh, Abiodun OSIKOMAIYA, who is also the executive secretary of the Lagos State Blood Transfusion Service. She's in transit at the moment. She's been working very active since yesterday. A lot they've been doing, and yeah, she's here now to tell us all we need to know about blood and, of course, everything that has to do with blood. But there is a core focus today. But first of all, let me just welcome our guest. You're welcome, ma.
Thank you very much, everybody. It's wonderful being here. I was here by this time last year, so it's so exciting.
Okay. Yeah. Uh, very good. Nice to have you again. Yeah, I think you should just give me a minute. There's something with the audio. I think I couldn't hear you again. So let me just do a break, but just remain on the line, everyone. Sorry for this. It's quite funny that this happened just now. I want to sort it out. Just stay with us, guys. I'm going to play a video, just something not related to blood, though, but it's all about development. Just stay with me for a minute.
Well, I think first and foremost is to recognize that agriculture is not a way of life. Agriculture is a business. It's a wealth-creating sector. You know, you take a look at Africa today. In total, Africa spends, $35 billion a year importing food that it should be producing. And if we do nothing about that, by 2025, Africa will be spending another $110 billion importing food. So the things that have to change is how we take agriculture. We must take agriculture as a business that can create wealth and revive our rural communities. The second thing that has to change is that for all the things that Africa produces, I see Sir Jeff over there producing maize, but also whether it is rice, whether it's cassava, whether it's coffee, whether it's cocoa, whether it's tea, whatever it is, or cotton, Africa has to absolutely add value to everything. It makes no sense today that Africa accounts for 75% of the global production of cocoa, but Africa gets only 2%. 2% of a $100 billion market for chocolates. So the price of cocoa will fall, like it has just fallen. Again, Cote d'Ivoire is losing $1 billion as a result of that. But the price of chocolates never goes down. The price of cotton will fall, but the price of textiles and apparels will never go down. And so the price also of coffee beans will fall, but never the price of brewed coffee that people are making money smiling all the way to the bank. And so we've got to make sure that we make agriculture value chains that allows Africa to add value to everything it produces. And that's why within the African Development Bank, we've taken this.
Okay. For that. Yeah, welcome back, man. Very sorry for that error there. So, yes, today we want to talk about blood and everything about blood uh, transfusion and even blood donation. So, but first, man, let's start with the activity lineup for this week celebration, the observation of World Blood Donor Day. What has it been for you at the Lagos State Blood Transfusion Service?
Um, Yesterday was the first time we're having our donor drives since the COVID pandemic. Hope you know that during the COVID pandemic, because of the lockdown and the restrictions, we had to cancel all our voluntary donation drives. So we opened up blood donation again yesterday to commemorate the 2020 World Blood Donors Day. It was full. We had to do a lot to make sure that we ensured social distancing. We had to do all that we could to make sure that there was water to wash hands and there was adequate hand sanitizers. We distributed face masks for everybody so that we can all feel safe and not go back feeling that we have been infected or infected others. So we had a wonderful turnout. We decentralized blood donation yesterday to all the blood donor centers in the 27 general hospitals. And we had a live feed on Zoom. So even though you are at the facility, you can know what is happening at other facilities. It was a very, very exciting time. And today we also had the webinar. We had Professor Akwamu who talked about transfusion generally. We had Mr. Saliu, the country director of Blood for Africa. He was also here to talk to us about making sure there is constant blood supply during this COVID pandemic. And then we had Dr. Dosumu, an associate professor from LASUT, that is Lagos State University Teaching Hospital, talk to us about blood safety during the COVID pandemic. We had a wonderful time so far, and it continues tomorrow with blood donations all through at the donor centers and a donation from one of our wonderful groups.
Okay. Yeah. Thank you very much, Ma. So now I I know it's been a very interesting one. So first, maybe for those who are listening to us now, what has it been so far when it comes to blood donation in Lagos? Because I recall that yesterday, in a tweet message by the Honorable Minister for Health in Lagos, he talked about the number of voluntary donation in Lagos and those who get to donate not voluntarily, maybe perhaps something happened to them and it become necessary to have to donate blood to help a member of their family. So what has this been so far in terms of blood donation in Lagos?
Truly, right now we have 10% of all our blood donated coming from voluntary blood donors. And we all know that the only way we could have a sustainable blood supply is if all our donations come from voluntary donors. So we have a 10% deficit of blood donation coming from replacement donors and in some circumstances, commercial donors. It is of note that the Lagos State and so that means that we really need to do more, to do a lot of advocacy so that many more people can become regular voluntary donors. Now, WHO, which is our supervising body worldwide, has of the population of every state is what we need to sustain the blood needs of that state. In Lagos State, we have an estimated figure of 26,000. The documented one in 2004 was 20 million. So we have about 26 million estimated to be the population in Lagos State. This means that we need at least 260,000 units of blood for us to be able to sustain our blood needs in Lagos. And I can assure you that we are far from that target number. And so this is a shout out and a cry out to everybody listening now, everybody partaking in this particular uh, program, to please come out and become voluntary blood donors to help sustain the needs in Lagos State, to help save lives, and to help make sure that somebody goes home with a smile on his or her face.
Wow. It's a huge number there. 260,000 units needed in Lagos. But then again, I know people want to wonder is that from experience as a meteorologist, a professional in this field, what do you think has been hindering people from donating blood?
Yes, the most common reason people refuse to donate blood is that they feel they don't have enough. It's not actually the fear. They are like, oh, I do not have enough blood in me. How can I give when I don't have? But people should understand, everybody out there should understand that we will not collect blood from you except we test you if you've got adequate amount of blood or not. The second reason why people do not donate blood is the fear of pain. People believe that blood donation comes with a lot of pain. The truth is that you will feel the pain of the needle prick, but that is all you will feel. The pain of the needle prick is once, and once the needle is inside your vein, the blood will flow seamlessly into the blood bag and you will feel no other pain. The third reason why people do not donate blood are fears and fads, and we have been able to work on that much more than it used to be. So we have been able to educate a lot of people that blood donation does not cause any form of spiritual complications. So some people believe that if they give out their blood, something bad will happen to them spiritually. It's just a fad, it's just a fable. We have made people understand that if you donate blood, you are doing yourself more good than harm. You will have a better clinical state. Your red cells will be revitalized. You have a reduced incidence of having cancer. You have a reduced incidence of having cardiac complications, a reduced incidence of obesity, and you always have a regular health check every time you come for a blood donation. So we have had that advocacy telling people about the advantages, and it has made that part of blood donation easy for us.
Okay, let me just say, if you're listening to us on radio or on YouTube or Facebook, or would like for you to just drop your comment, let us know your experience if you've donated blood, if you've ever donated blood, and if it's voluntary, it was voluntary, and tell us about your experience so far and whether you've donated or received blood for any reason. The message is at the bottom of the screen for those watching us on Facebook and Twitter to see. Now, Dr. OSIKOMAIYA, I know of the fact that there's so much for us to talk about blood, but then I know one of the things you're trying to achieve at this period is to let people understand about convalescence plasma therapy. Before we come into that, really, if time would permit, should we have questions about blood-related concerns from those listening? I don't know if you be ready to take some of those questions.
Yes, I'll be ready to take all questions.
Oh, okay. So before we go into that, now there is this court judgment on the compulsory blood donation by especially by husbands who have wives that want to give birth at public general hospitals in Lagos, and the court judgment pronouncement is that that must be stopped, that practice must be stopped. So how is the state coping ever since that judgment?
You know, the truth is that nothing good comes easy. There is no way we can continue to advocate for voluntary blood donation if we do not desensitize the state that having commercial donation or replacement donation will not work out. Also, it's a good one because what that judgment said is that there should be no compulsory donation before registration. It means that we are concerned about the state of health of our pregnant mothers. So we have been coping fine. It's been quite tough, but we have been doing our best to cope fine. This means that we have to do more counseling to all husband donors. That please, we are not saying you should donate the blood for your wife. Um, as a replacement one, but we want you to come in as a voluntary blood donor. At that time, they were donating blood for their wives as husband donors. They would only donate for that pregnancy. But once we are able to counsel them and advocate for all, voluntary blood donation, these men keep coming back. So it has been a little bit tough, but it is better than before. We are working hard to sustain a continual blood donation from this set of people. And once again, I'm appealing to everybody, I'm reaching out to you all. Please make up your mind, make a decision that henceforth you become a voluntary blood donor to help keep the lives of Lagosians and the whole Nigeria safe.
Okay, just for those who don't know, every June 14th of every year is the World Blood Donor Day, and of course, it's a day set aside to create awareness on blood donation and even blood transfusion, and as well as to appreciate those who voluntarily have been donating blood to save lives. So the theme for 2020 is "Safe Blood Saves Lives." So now, let's come to convalescence plasma therapy now. Tell us about this and it's the connection to the theme for this year, Save Blood Saves Life.
Okay, convalescent plasma is actually plasma gotten from somebody that has had an illness. So it's a plasma from someone that has recovered for a particular illness that is supposed to develop antibodies. So the COVID-19 infection is one of those conditions whereby we could have convalescent plasma therapy. So what I'm trying to say is that once you recover from COVID infection, then your body forms antibodies against the infection, and this is believed to help to save other people's lives. So this year it is Save Blood Save Lives. We are talking about this topic came in the light of the COVID pandemic because there were lots of fears about the safety of blood during this pandemic, and there were lots of fears about the safety of the donor and the blood that was being transfused. So those are two things that have been going on now. So back to convalescent plasma. We have used this period to encourage everybody that has survived to please come back to designated isolation centers for their plasma to be collected and stored in line for treatment for patients with severe cases of COVID-19 infection. So we have an ethical approval from the state to do this study, which we have not yet started. We need to get this plasma together first and process it right so that everything that we need to know about that plasma is done before we begin to transfuse in people with severe cases. So once this is done, we will be saving a lot of lives. All the severe cases that has caused a lot of deaths may be avoided with the treatment from this convalescent plasma therapy.
Oh, wow, interesting. Yeah, I know this would generate lots of reaction because some of us have been wondering that even before I got to hear about the need for this to study those who have survived COVID-19, I've been wondering if we have people or older people who have survived, we have younger ones who are dying of the virus, then what are we really doing to ensure that we study the things that are present in the body of the survivors? So if I understand very well, this therapy will be a study of the blood component of the survivors.
Yes, this therapy is actually it's actually to treat those with severe cases. But before we can use it for treatment, we need to study more about the plasma, check for neutralizing antibodies, deactivate any other viruses that we do not know of. So we'll do a deactivation therapy on it to make it exactly and completely safe for treatment.
Okay, so when you say treatment, you are we talking about transfusion, collecting the blood sample of the survivors and transfusing to those who are suffering from the virus?
You're right.
Oh, wow. Okay. Uh, what are the challenges? Why do you think your survivors are not coming out?
Well, there's a lot of stigmatization with COVID-19 during this COVID-19 pandemic. People are afraid, and then people do not feel safe too, as they don't want others to know. They don't know what if it will. There's a lot of poor education around it. So we have taken time out to educate the survivors, even when they are on admission. We don't wait for them to go back home before we tell them about donation of convalescent plasma. So, and then we've told them, please, we've done a lot of education in the society, in the community, that do not stigmatize people that have recovered. They need our support instead of discouragement. So we are supporting them, sending messages out. Be nice to people that have survived. They are survivors, and we need to support them to be able to save the life of others.
Okay, so that would mean that during the period that they were undergoing treatment across the different centers in Lagos, uh, it wasn't compulsory for them to make that donation before they leave, even after they've been declared free of the virus.
Okay, we cannot collect convalescent plasma from a survivor until at least 14 days after they've recovered. So this means that they still need to go. The body takes a while to develop those neutralizing antibodies. It starts developing from about 10 days from the time you have recovered from that infection to about 30 days. So the time for collection starts from 14 days after you've recovered, 14 days after a negative result. Once they are negative, they are discharged home. We do not leave them in the isolation center. So they need to go back home first and then come back after 2 to 3 weeks to have their plasma collected.
Okay, so one will wonder, how is this different from the regular blood donation?
Yes, it's completely different because the blood donation, you are the person donating blood. Before you can donate blood as a voluntary donor, we would eliminate you with a COVID suspect list. So if you have a suspect, if you are a suspect, or if you have the COVID infection, we will not collect blood from you. This is because we are not sure of a transmission of COVID in blood. There have been no written documentation that there is COVID
Okay.
viruses in blood. There is no written documentation. We have not heard of any written documentation of infection or of being infected with COVID through blood donation. We have had no written documentation. However, because we do not understand what the COVID virus is, we need to be very, very careful of the way we collect and the way we transfuse blood from donors. So, with a positive case or someone that has recovered from COVID, we do not transfuse their blood to others. The only thing we take from them is their plasma. The blood is not used, it's just the plasma, which is used as a form of treatment, not a form of replacement for those that need blood.
Oh wow, yeah, yeah. I understand it better, and I hope those
Yes.
following us understand as well. Now at this level, considering the challenges we're facing in Lagos, even in Nigeria at large, to have people voluntarily come out to donate blood, how far do you think your campaign will be successful on having those who have been successfully treated of the virus to come out and donate their plasma?
Well, it is getting better. For this reason, we have a COVID follow-up clinic. So we have a center at Mainland Hospital, as at this isolation center there. We have the COVID follow-up clinic. Actually, even though you have been discharged, you still need to follow up on your care because just like in every clinical condition, once you're ill and you get better, you need to come back to the clinic to see your doctor to let us know how you are feeling. That is the same way it is here. So we have a follow-up clinic for all discharged patients who have survived COVID. So when they come, we will counsel them. Apart from the one that is being done on the ward, we give them a questionnaire. They will consent to give their plasma or refuse to. So this is the period we take the plasma from them.
Okay, so should someone refuse to donate plasma because as it is in the country, especially in Lagos, the number of COVID-19 infection is on the increase, and
Yeah.
we know it's costing so much to treat the patients. So should people refuse to voluntarily donate? Is there room for any monetary incentive
No, there
to
is
convince
none.
people to think otherwise?
No,
Like, you know
no,
how
there
people
is.
reason at times.
Yes, but they also know that the Lagos state government has been magnanimous enough. We have done everything we can. We have helped in making sure that they are survivors. Nobody has paid for treatment, and we really thank God. We are really grateful to NCDC and the Lagos state government. So many people willingly do this because they know that their care was completely taken over by the states. Understand? So it's only when you are not fit to donate plasma that they do not. And some actually ask that they come back to donate the plasma. So it is a personal decision, and we do not force to donate. It is voluntary, and we've been having better outcomes. So we still want better ones from these survivors.
Okay, so that is on the plasma. I won't want to engage you on the COVID-19 itself because your core focus is everything that has to do with
Blood.
blood. Yeah, yeah. So yeah, but then again, I am tempted to ask that: do you think with this the plasma therapy, it's going to reduce the cost of treatment? Because there's no known absolute or drugs
Good.
to treat COVID-19. So it's just about professionals like yourself coming up to study individual patients and
Yes.
recommend, solutions that you can readily think of that is available. But do you think this will reduce the cost in treatment?
Well, I cannot particularly say so because, as you have actually made everybody understand, there is no known treatment. These are studies that are going on. The truth is that once we've gone past this phase, then we can know what the treatment form will be. Since blood is free and cannot be manufactured anywhere, it is expected that the plasma that is being donated should come in at a cheaper rate. But I also mentioned that we do a lot of investigation on the plasma. We have to deactivate any form of viruses that we do not know of that are in the blood. We have to check each unit of plasma for neutralizing antibodies. So I cannot particularly say that it is cheaper, but what we all focus is not the cost of treatment, but the lives of people that are saved and the reduction in the number of people that die from this COVID-19 infection.
Okay, so is this particular therapy, lastly now before I let you go, because we're almost on the 30 minutes mark now, is this
Yeah.
particular therapy, is it a new therapy or a therapy that has been in existence before?
This
Like
therapy has been in existence before now. During the Ebola period that we had in Nigeria, this was when convalescent plasma first came into Lagos. During the Ebola pandemic that happened, we had an opportunity to be trained on this. We're given equipment for this, and that is what we have started using, and people have donated more. So it happens in viral infections generally. It is in viral infections that you have antibody production, which can be used to treat subsequent viral infection. So use of convalescent plasma, it's not new. It is not a novel form of treatment. It has been going on for years, and it will continue as long as you continue to have viral infections.
okay, Dr. Bodurin Oshikomaya, it's really been a pleasure with you. I'm very sorry we lost some couple of time there when I had to fix something with, because at some point I couldn't hear you. All you said
Oh,
at the beginning, yeah. So
yeah.
I didn't know what happened. Yeah. But thank you very much, ma. I know this is ongoing conversation, and
Yes,
definitely we can really create another 1 hour time to have a more interactive conversation on blood, and
yes,
even explain more as it relates to the treatment of viruses
yes,
and of course the convalescent plasma therapy. Thank you
yes.
very much, Dr. Bodurin Oshikomaya.
Thank
Thank
you
you
for
for taking
having
time
me.
out. I understand what you're going through, running from, it's a busy week for you. Yeah,
It's been
I
a very,
understand.
very, 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 very busy week. I have another meeting this evening, and that is why I had to take this in motion.
Yeah,
Thank you very
it's
much. I
okay.
had a wonderful time talking with you.
Yeah, thank you very much. The pleasure is
Thank
mine.
you very much.
Yeah, guys, that was Dr. Bodurin OSIKOMAIYA of she is the executive secretary of the Lagos State Blood Transfusion Service, and I hope we've learned one or two things about blood, and of course, most particularly, what the Lagos State Blood Transfusion Service is doing to help in the treatment of COVID-19, talking about the uh, convalescent plasma therapy. So, guys, until tomorrow again, will be another 30 minutes with me, Tweetuya. I say thank you very much for your time. And yeah, you can go, man. They can't see you anymore. I'm the only one seeing you. They can't see you anymore. You can go. Yeah. So, all right, guys. Yeah, she was just giving me a sign. She didn't know I've taken her off the screen already. Okay, so we'll do this tomorrow again. Yes, but tomorrow in particular, we'll be traveling the different routes. We'll be traveling, not when I say traveling, not be say I go come out for Lagos, but we'll be visiting Edo State. Let's talk a little politics. Yeah, I'll be having Dr. Square to join me, and I'll have some members of the PDP and APC in Edo State join us as well. Let's talk politics tomorrow. Tomorrow is Tuesday. Let's talk Edo State, and then we'll see this week if we get to talk about Ondo State as well. My name is Tweetuya. Thank you very much for your time. I say do have a wonderful day.